Erectile dysfunction can happen to any man. It can happen to any man, provided the man is sexually active. So in this particular video, you are going to learn how you as a guy can manage erectile dysfunction without having to pay a dime to anyone. Yes. A few days back, I made a video on erectile dysfunction and what causes erectile dysfunction. That is failed erection. And I got a question that asked, how do I treat or how do I manage erectile dysfunction? So in this particular video, you are going to learn how you as a guy can manage erectile dysfunction without having to pay a dime to anyone. Yes. So don't leave this page. Don't scroll. Watch till the end. Erectile dysfunction, simply put, is inability to sustain hard and firm erection enough for sex. That is just it. You are having an erection, but it's not strong enough, it's not hard enough, it's not firm enough for sex, right? So, funny thing about this erectile dysfunction is this. Erectile dysfunction can happen to any man. It can happen to any man, provided the man is sexually active. So let's dive into the treatment. In this treatment, I'm going to divide it into two. What you as a guy who is experiencing erectile dysfunction can do for yourself, and what medicine or medical practitioners can do for you. So what you can do for yourself first. In what you can do for yourself, it starts with your lifestyle modification. How do you live? Are you the type that hate to involve in any physical activity? That might be the cause of your problem. Yes, you may need to start exercising. Exercise, it goes a long way in helping blood circulation around the body. An erection is largely dependent on blood flow. If blood is not flowing very well to your penis, you might be experiencing erectile dysfunction. That might be the cause of erectile dysfunction you're experiencing. So you need to start moving your body, you need to start exercising, you need to do some physical activities. If you're a chronic smoker, guy, you need to cut down on your smoking habit. There are toxins in cigarette that can cause alteration in your reproductive health. So you may need to adjust your smoking habit. Alcohol is also inclusive. Not every beer, not every drink is good for your body. So you need to check what you are drinking. Are you drinking too much? Are you drinking the one that is not good for you, that is causing problem in your body? So you need to limit your alcohol intake. Another thing you can do for yourself is your nutrition. What do you eat? There are fruits, there are vegetables that are suitable for your sexual health, that they do magic for your sexual health. Example, banana, oranges, dates, tiger nuts, watermelon. Make smoothies with these fruits. If you cannot eat one alone, you can make fruit juice with them, so that you can have the vitamins and the nutrients these fruits and vegetables give in your body to help build up your reproductive health, so you can function very well as a guy who is ready for, meeting a lady. And if you have any underlying illness like low testosterone, high blood pressure, diabetes, nerve dysfunction, you may need, in fact, you will need to treat that ailment to ensure that the erectile dysfunction you're experiencing is not caused by any of those ailments. For example, low testosterone. Testosterone is a sex hormone. In fact, it is the chief of all the sex hormones in the males. Yes. So when it is low, there is possibility that you're going to be experiencing erection, but it won't be firm enough for sex. And if you're also having diabetes, high blood pressure, there is limited blood flow to some part of your body. Blood flow in your body is not the same thing like someone who is not experiencing diabetes or high blood pressure. So you will need to treat those underlying diseases. You need to get yourself treated. This is what you can do for yourself. And lastly, what you can do for yourself to manage erectile dysfunction is to reduce your stress level and your anxiety level. Are you this type of guy or man that whenever you're on the bed, you are very anxious, you just want to go in there and come out and that just it? No, be relaxed. Be relaxed. Find pleasure in having sexual intercourse with your partner. Find pleasure in interacting with your partner. Start with foul play so that your whole body will get into the mood, your whole body will get into the act before you start climaxing. Another thing comes into play, right? So manage your anxiety level. Do not be so anxious to just go in and come out, you release, you're out, and that just it. No. Please manage your anxiety level and your stress. Stress has a way of dealing with you. Yes. Now, this is what stress does. It helps to increase the cortisol level. There's a hormone in the body known as cortisol, and this cortisol affects your testosterone. And you know, testosterone is the sex hormone. So when this cortisol is elevated, your sex hormone is decreased. So increased cortisol, decreased testosterone. That is your sex hormone. So if your sex hormone is decreased, you will be finding it difficult to have firm erection or hard erection enough for sex. So you need to manage your anxiety, you need to manage your stress level. So these are things you can do for yourself: your exercise, your physical activity, your nutrition, stress, anxiety, and treatment of underlying diseases. These are things you can do for yourself to manage erectile dysfunction. Now, let's get to what medicine can do for you, or what medical practitioners can help you with in managing erectile dysfunction. One thing with this part of treatment is that this medicine or medical practitioners are not going to come to your house. They won't come to your house to drag you to come to them for you to be treated. So you have to accept on your own that you need to get help and visit the hospital. Medicine will give you psychotherapy. That is trying to work with your mind, trying to reset your mind about the whole thing. If you're a guy who is already depressed because I can't satisfy my partner, I can't satisfy my woman on the bed and all that, you will need psychotherapy. You need to be talked to, you need to be encouraged, you need to be counseled so that you will have a relaxed mind, a less anxious mind when meeting a lady. So first thing they will do for you is psychotherapy, counseling. So medicine will help to counsel you, medicine will help to reset your mindset about erectile dysfunction. Medicine will also provide you with penis pump, what is known as vacuum erection device. I repeat, penis pump. What this penis pump does is that it creates a vacuum around your penis. When it creates this vacuum, so that there will be space for blood to flow into anytime you are having sex, there will be enough space for blood. This vacuum will draw in blood into the penis and trap it enough that it will be very firm, so that the penis will be strong enough for sex. So medicine is going to provide you with that. That is penis pump. Another thing medicine can do for you is to provide you with medications. There is what is known as penile injections. This injection gives you erection within 15 to 20 minutes of administration. Drug is being injected into your penis, and within 15 to 20 minutes, you're already experiencing erection. That is what this medication does. Medicine will also provide you with penile implants. These implants are surgically placed. That is, a surgery is done in the penis to place these implants. These implants that are semi-rigid devices, are inflatable devices placed in the penis that will help with erection. So that's just what this implant does. And medicine will also provide you with hormonal therapy. Don't just go to the pharmacy and get synthetic hormones by yourself and consume. No, allow the doctor to prescribe what you need. Allow medicine to have its way in treating erectile dysfunction for you. Okay, so they're going to place you on hormonal therapy that will balance the hormones. In If the erectile dysfunction you are battling with is due to low sex hormone, so you need to balance, you need to optimize your sex hormone so that you know it will help in driving erection. So these are basically what medicine can do for you and what you can do for yourself as a guy who is experiencing erectile dysfunction. I hope this video has clearly answered that question. So, and if you have more questions on this video, do not hold yourself to ask. Push every question to the comment section and I'll be there to answer every one of them. All right? I am Nosamara Chuku, and around here we talk real about sexual health. No myth, no shame, just care and clarity. See you in my next video. Bye.